Chelsea, is there an instance that you feel like we might not be able to get somebody to the paraphysiological space?
No.
Why do you say that?
Because the body is meant to go in that space. It just needs a little bit of help from a chiropractor.
Sure. Yeah. So we discussed yesterday how the adjustment doesn't take somebody past their anatomical limits. So you're correct. The paraphysiological space is within the realm of possibility.
Yeah.
And in order to achieve proper health, we need to be able to utilize that and maximize it. But what do you have to work through in order to get to that?
You have to work through the other spaces.
Okay. I thought of you because of your son,
Okay.
Xavier. So I got Xavier adjusted for the first time in a long time a few weeks back. And this young man was on the table and he gripped so tight, he guarded so tight that he was blocking me, and it sounds like every other chiropractor at Ability that he's worked with, from even getting through the active range of motion.
Okay.
So I will tell you that 80% of the adjustments I did on him did not get him to the paraphysiological space because he was so protective. And how many times does this happen with your patients? They're reluctant, they're apprehensive, they're scared, they don't know what to expect, so they guard. So what do we do? What do you do if you can't take somebody through a manual adjustment and get them to that all-important space of stimulation?
I would think trying to use some sort of distraction tool.
That helps. That works every now and then. I asked Xavier to wiggle his toes. Didn't work because somebody's already asked him to do that. What else?
Talk them through why they need to relax.
Great. Has your son in his weekly adjustments for the last 10 years, has he gotten better at relaxing?
No.
No. What else?
I don't know. I don't know what the next step
Are there
would be.
any other techniques that we could use?
I'm sure maybe an activator.
Takes out the guarding altogether. Cool.
Yeah.
Can you get somebody to a paraphysiological space using an activator?
I would think no.
Okay. But does it, and would it provide more stimulus than having somebody just guard, right? Like you'll activate more proprioceptors with an activator than you will trying to work through somebody's stiffness and guarding, right? What other techniques?
I don't know. Maybe using like the anterior or just adjusting in a different way.
Style. Yeah. What position can you get them in that allows them to relax? Not always what trick, but if it's an anterior, is it a seated cervical, which you like? What about the drop tables?
Yeah.
Yeah. A quicker thrust, letting some of the table take a patient through their active and passive range of motion and into the paraphysiological space. So make no mistake about it, like the hands-on adjustment is the best. But when we have a patient like Xavier, who through time and time and time again is unable to relax, then we have to look at what other methods are out there to get him to the point of neurological benefit of chiropractic care.